Hi everyone, this is Asaruddin. Welcome to my YouTube channel. If you are new to this channel, consider subscribing and also check out my Instagram where I post regular case details. Welcome to the scientific series of muscles. Today we are going to talk about science behind Gluteus Medius. Come on, let's start. We'll start with naming why this muscle called Gluteus Medius, because it presented over gluteal region and it's smaller than Gluteus Maximus and larger than Gluteus Minimus. It's a medium-sized muscle, so it called Gluteus Medius. Next, we'll see the attachments. It attached proximally just inferior to the ilium and anterior posterior gluteal line, and in between anterior posterior gluteal line. Distally it attached little bit lateral surface of the greater trochanter. Next I am going to explain functions or action, concentric action of the Gluteus Medius. I am going to classify this into standard mover action and reverse mover actions. Most of the movement happen in Gluteus Medius distal to proximal, right? So distal attachment here, proximal attachment here. Proximal is mostly fixed attachment and distal is movable attachment in Gluteus Medius. So we can call distal attachment more mobile attachment. So this is an insertion, this is an origin of Gluteus Medius. Now easily we can classify standard mover and reverse mover action is moving insertion to origin called standard mover action, origin to insertion called reverse mover action. First we will see the standard mover actions. Standard mover actions, the entire muscle fibers of the Gluteus Medius think running vertically. This is a primary action, running vertically. So if we pull these entire muscle fibers, it helps to abduct the femur at the hip joint. So the entire muscle fiber helps to abduct the hip joint. One more important feature of this muscle action and fiber orientation and attachments, everything mimic deltoid muscle of the upper limb. Which will move into other actions. The anterior fibers have separate action and posterior fibers have a separate action. I will come to posterior fibers. Posterior fibers of the Gluteus Medius somewhat running both vertical, horizontal, oriented, oblique manner, right? So, and it crosses posteriorly at the hip joint posteriorly. So if you pull these muscle fibers in this direction, it helps to extend the femur at the hip joint, and also if you pull these muscle fibers, it will produce one more action. If you pull these muscle fibers, it posterior-medially rotate the femur at the hip joint. So it causes external rotation or lateral rotation of the hip. So posterior fibers of the Gluteus Medius helps to externally rotate and extend the hip joint. And anterior fibers of the Gluteus Medius fibers are running similar like a vertical and horizontal mixed manner of oblique in direction. So if you pull these muscle fibers, and also it crosses the hip joint anteriorly. If you pull these muscle fiber, it helps to flex the femur forward, bend the femur at the hip joint. And also if you pull these muscle fibers in this direction, it helps to anteromedially rotate the femur at the hip joint. It causes internal rotation of medial rotation of the femur at the hip joint. So anterior fibers of the Gluteus Medius helps to medially rotate and flex the hip joint. As I say, it's similar to the deltoid. Deltoid also anterior fibers and posterior fibers and entire muscle do the same action of shoulder joint. Keep in mind, this anterior and posterior fibers of the Gluteus Medius not a primary movers of flexion, extension and rotational movements of the hip joint, but it helps in those movements. So take into this consideration while assessing the patients. Next we will move into reverse mover action. The distal attachment is fixed. If muscle moving origin to insertion, these all vertical muscle fibers pull in this direction, downward direction. It helps to, or it leads to depress the pelvis at one side. So it's an important major action of this gluteus medius muscle, because one side depression of the pelvis leads to elevate the opposite side pelvis. I'll explain. Look at here. Here is gluteus medius attaching. Okay. If I pull this muscle fibers, okay. Sorry. Here is gluteus medius muscle is attaching. If I pull this muscle fiber inferior direction, it depress the pelvis at one side, it cause elevation of the opposite side pelvis. Why is important? Because while walking, depression force of the supporting limb helps to prevent depression of the swinging limb on opposite side. So this is the test we are using Trendelenburg sign while frequently in to assess the gluteus medius weakness. Again, think about distal portion is fixed, moving proximal portion of anterior muscle fibers and posterior muscle fibers. Posterior muscle fibers and anterior muscle fibers are crossing the hip joint anteriorly and posteriorly in oblique plane. If I pull this is fixed. If I pull these muscle fibers inferiorly, arch into insertion, it leads to anteriorly tilt the pelvis. And posterior fibers, if I pull posterior fibers in this direction, it helps to posteriorly tilt the pelvis. So gluteus medius anterior and posterior muscle fibers helps to anteriorly tilt and posteriorly tilt the pelvis also. This is not a primary action. For the tilting movement of the pelvis, it also works. The anterior and posterior fibers of the gluteus medius helps to contralaterally and ispilaterally rotate the pelvis. I will explain how. These posterior fibers of the gluteus medius running somewhat vertical in transverse plane. Think about transverse plane in this direction. So if I pull these muscle fibers proximal to distal downward direction, it helps to rotate the pelvis contralaterally. And anterior fibers of the gluteus medius running in the horizontal and transverse plane. If I pull these muscle fibers, it helps to ispilaterally rotate the pelvis. Contralateral rotation, ispilateral rotation is nothing but ispilateral rotation means same side rotation of the pelvis, and contralateral rotation is opposite side rotation of the pelvis. And take into consideration all rotational and tilting movement of the pelvis contributed by gluteus medius. So it was one of the important muscle while walking or gait. Next we will move into movements. Middle fibers of the gluteus medius have one line of pull in cardinal plane. So it create a movement of abduction of the hip. And anterior fibers of the gluteus medius, it produces the combined movement of flexion, abduction and internal or medial rotation of the hip. And posterior fibers of the hip joint produce the movement of combined extension, abduction and lateral rotation of the hip joint. Regarding the reverse mover action, middle fibers of the gluteus medius helps to depress the same side pelvis, and anterior fibers of the gluteus medius produce the combined action of anterior tilt and depress and ispilateral rotation of the pelvis. And posterior fibers of the gluteus medius helps to produce the combined movement of posterior pelvic tilt and depress and contralateral rotation of the pelvis. Eccentric or antagonistic function, it restrains or slows the movement of exact opposite movement of the action. Middle fibers do adduction of the hip and anterior fibers will do extension, external rotation and adduction of the hip. Posterior fibers will do flexion, internal rotation and adduction of the hip. And similarly to the arch into insertion reverse mover action also, middle fibers will do elevation of the pelvis at the hip joint, and anterior fibers will do posterior tilt, elevation and contralateral rotation of the pelvis at the hip joint, and posterior fibers will do anterior tilt, elevation and bilateral rotation of the pelvis at the hip joint. These are all the eccentric and antagonistic function of the gluteus medius. Next, isometric stabilizing function of the gluteus medius. It stabilizes the pelvis at the hip joint. When gluteus medius contract, it depresses the pelvis at one side. It creates the lateral tilt force. Lateral tilt force helps to prevent depression of the opposite side pelvis. This is important during walking. Every time you lift one limb off the floor, that side depression prevented by opposite side gluteus medius isometric stabilization function. And also gluteus medius helps to stabilize the subtalar joint because it helps to laterally rotate the femur, but this is not a major action. If you want to know more detail about how lateral rotation of the hip joint helps to support the subtalar joint, click here. Next, relationship to the other structures. Posterior fibers of the gluteus medius deep to the gluteus maximus, and anterior fibers of the gluteus medius deep to the tensor fascia lata, and middle fibers of the gluteus medius is superficial. Second point, anterior fibers of the gluteus medius lie next and deep to the tensor fascia lata. The tensor fascia lata and anterior fibers of the gluteus medius fibers are essentially running in the same direction. And third point, posterior fibers of the gluteus medius lie next to the piriformis. Piriformis and posterior fibers of the gluteus medius fibers are essentially running in the same direction. Fourth point, gluteus minimus presented deep to the gluteus medius. Fifth point, gluteus medius forming the lateral myofascial line. Next we will move into key points. First one, posterior portion of the gluteus medius is thickest part, so this action is strongest. Like extension, abduction and lateral rotation action is strongest action of gluteus medius. Second point, thick layer covering the gluteus medius muscle. This layer called gluteal fascia or gluteal aponeurosis. Third point is, as we know, gluteus medius contract, it depress and create lateral force to elevate the opposite side pelvis, right, while walking. But not only while lift off the floor, when we stand with both legs, we used to habitually we used to shift weight on one side, right? If we do this is also causes activate the weight shifted side gluteus medius to chronically tight. Fourth key point is, chronically tight gluteus medius leads to postural condition, like one side shortening of the limb. That leads to compensatory scoliosis occur at the spine. When the gluteus medius is tight, it depresses the pelvis and elevate the opposite side pelvis. It becomes chronically tight over and over again and again. It leads to shortening of the contralateral limb length discrepancy or minute changes it happen. That leads to uneven sacrum level. That can lead to compensatory scoliosis occur at the spine. Note this point, our head should be level to maintain proprioception and balance. Our inner ear and eye should be level to maintain visual proprioception. So, one side gluteus medius tightness can lead to balance and proprioceptive issues also. Fifth point is easy way to palpate the gluteus medius. Gluteus medius action, or it will activate when you shift weight on one side, right? Then stand and rock back your weight and palpate your gluteus medius. Sixth and last key point is, gluteus medius have a same fiber orientation and actions like deltoid. So it also called deltoid of the hip joint. Hope you enjoyed this video. And don't forget to share with your colleagues and friends. If you like this information and you want to learn more information like this, please subscribe to our channel. Thank you.